name is Marina Kuperman. Thank you so much for joining me today. Today, I'd like to discuss Pap smears. Women are always asking me, how often should I be getting a Pap smear? Why do we need Pap smears? What are we testing for when we do a Pap smear? And so, I'd like to spend some time today talking about the importance of Pap smears and why you should get one and how often. Pap smears are the cervical cancer screening tool. Cervical cancer is silent. And what is a cervix? The cervix is the opening of the uterus. So it looks like a little donut. And it's the part of the uterus that opens to 10 centimeters when you have the baby. So there, at one point, when the Pap smear was invented, there was an increased amount of women who were coming up positive for cervical cancer. And so Papa Nicolau, he was someone who invented the Pap smear, invented this screening tool for how to routinely screen women for cervical cancer or cervical cell abnormalities. And Pap smears are typically done annually or every 2 or 3 years, depending on the history of your Pap smear. So if you've had an abnormal Pap smear in the past, if you've had human papillomavirus, and I'll touch base on more about human papillomavirus in a little bit, but if you've had an abnormal Pap smear in the past, then you should do the Pap smears more frequently, just to keep an eye on what is going on with the cells of your cervix. So basically, a sample is taken from the cervix. It's a brush. There's a brush that just brushes the cervix, and those cells are sent to a lab where the lab pretty much tells us whether or not the cells on your cervix are normal or whether or not there's some type of abnormality. And the grading level of abnormality. In addition to that, I usually send for human papillomavirus. Human papillomavirus is HPV, is a sexually transmitted virus that a lot of women, over 80% of women, have been exposed to HPV. And just like any other virus, once your body has come in contact with it, it sort of gets stored in your body's hard drive. So it goes into a dormant phase. If your immune system is good, if your body is healthy and able to keep that virus at bay, it may not come up on every single Pap smear. I frequently get asked questions like, Maureen, what does that mean for my partner if I have HPV? Well, men are not as affected by HPV as women because they don't have a cervix. HPV is a common risk factor for development of abnormal cervical cells and cervical cancer. Men are usually not as affected by HPV as women are, but nonetheless, there aren't any true concerns, meaning you don't have to treat HPV if you come up positive for it. Do you have to tell your partner about HPV? Well, sure. You should be fully discreet with someone who you're in a relationship with. However, it doesn't pose as much of a risk to males as it does to females, so something to keep in mind. Can it cause abnormal cells on the cervix? Yes. And that's why if you have a history of HPV or if you have a history of cervical cell abnormalities, you should keep your body and maintain your body as healthy as you possibly can, maintain your immune systems so that your body can fight off the virus, keep it at a minimal level, and decrease the chance of abnormal cells forming on your cervix. The cells on the cervix rejuvenate very slowly, and so women who develop cervical cancer are usually those who have not been screened in a very long time, or women who are I've seen cervical cancer primarily in women who are older. It is 100% preventable. And what I mean by that is, again, if you're healthy, if your immune system is good, if you do Pap smears regularly, cervical cancer is 100% curable. There is the HPV vaccine, and it's given usually between the ages of 12 and 26. That's when it's most recommended. The earlier you get the HPV vaccine, the better. But I know women who have gotten the HPV vaccine into their 30s. So it's important to get vaccinated against HPV, and it's important to maintain your Pap smears. What I mean by that is get screened regularly for cervical cancer, because the disease is 100% preventable. If you have any other questions, feel free to reach me at the office or email me. Thank you so much for watching. Bye-bye.